Hey guys, what's going on? Tony here. So I wanted to talk about the difference between physical therapist and physical therapist assistant, and specifically talking about whether you should choose one path or the other when thinking about going to college. So I'm going to give you a very big, broad overview. I think probably what dictates what path you choose the most is actually not so much the money. I know plenty of physical therapist assistants who make as much or more money than physical therapists. It's probably not even the education. I know plenty of physical therapist assistants who are just as well educated as doctors of physical therapy, especially if they've had 5, 10, 15, 20 years of experience in the profession. The biggest difference to me, whether somebody chooses to go the route of doctor of physical therapy or physical therapist assistant, is really understanding where your passion lies. Now, your passion can change, certainly. I know my passion changed over the years. I'm still passionate about patient care, but less so passionate about delivering the patient care. I more enjoy the evaluation, developing the plan of care, establishing goals, and then transitioning that patient to the physical therapist assistant for the day-to-day treatment delivery. And that really is where this differentiation comes into play. Because the physical therapist assistant does not do the initial evaluation, does not generate the plan of care, but they are truly the experts in delivery of the plan of care, delivery and execution of the daily treatments. They're going to carry out the day-to-day. They're going to supervise and direct the patient treatment on an acute basis, whereas the physical therapist is going to be more kind of in a supervisory role, more oversight, more identifying problems at onset, and really kind of reassessing and progressing, from a high-level perspective. So I personally enjoy meeting new patients. I enjoy developing their plan of care and the evaluation, but I don't as much enjoy the day-to-day treatment delivery. Whereas I have associates, I pretty much exclusively work with physical therapist assistants that are incredibly passionate about the day-to-day treatments. They're incredible at what they do. They see things on a daily basis, and they've got so much more experience in that area than I do, simply because they're doing it all the time. And when you look at the curriculum, you look at the education, I would say the only differentiation that I understand, and maybe I'm wrong and you guys can correct me in the comments, is the doctor of physical therapy has the educational component of the eval, the plan of care, kind of the higher level stuff, the initiation of the program. But once you get past that, in actual care delivery, there is no difference between the PT and the PTA. Both are equally qualified to carry out the delivery of the service. So I would tell you, if you want to be a clinician who delivers the initial evaluation and oversight, being a doctor of physical therapy is an amazing opportunity. If you want to be a person who is going to be day-to-day involved with a patient in the trenches, working on, acute skill acquisition, a physical therapist assistant might be your preferred option. And I will say, in most settings, the physical therapist assistant spends more time with patient care and less time with documentation, whereas the physical therapist tends to spend more time with documentation and less time directly with the patient. So take that for what it is, but know that there are plenty of financial opportunities for physical therapist assistants to make just as much, if not more, than a physical therapist. I know a bunch of physical therapist assistants making 6 figures in director roles, but they're still active in patient care. And I know plenty of physical therapists who are making 6 figures both in patient care and director roles. So don't let the title sway you. Don't let the compensation sway you. Really figure out where your passion lies and where you think for the next 10, 15, 20 years you want to spend your time. Guys, thanks so much for the question. If you have others, post them in the comments below and I'll catch you on the next video.